obviously, we have been, I guess, I know I definitely have been in this sphere, being a mental health professional, where we've been trying to promote to employers all the benefits of if you intervene in mental health or do these positive things for employee mental health. These are all the benefits you're going to get. You're going to get more engagement. You're going to get high levels of productivity. This is your return on investment for every dollar that you put in. But it appears the carrot isn't working as well as we'd like.
It would appear so, yes. So absolutely we can start talking about your workers' compensation costs and your insurance premiums.
Yeah, that's right. And not to mention legal obligations, right?
Yes, absolutely. So as regulators get more interested in this, and certainly with the upcoming standard that's coming out, there will be, I think, increasing expectation that this is something that employers need to pay attention to. It is a legal obligation for them, and as we become more literate in talking about psychological hazards, it's certainly something that regulators are going to be paying a lot more attention to.
Yeah. And I guess at the end of 2018, we saw the Boland Review come out on the Model Workplace Health and Safety Act. And out of 34 recommendations, recommendation number 2 was to incorporate psychological health and safety much more into the Act.
Yeah. And that's been done to varying degrees in the different states.
Interestingly, WA is going to be joining the Commonwealth and following the Commonwealth WHS Act in the next year or so. Yep. And that's where we're expecting this to happen. And I guess what states are now doing and regulators is getting on the front foot. And that's why we see New South Wales put out their draft code of practice to help employers to take on the legislation changes when they come out.
Yeah, and certainly in WA, DEMERS have put out their code of practice for FIFO work. So for psychosocial risk in FIFO work, and that's obviously for a specific cohort. And there are unique psychological hazards for FIFO and for offshore work. But yeah, it's something that all regulators are thinking about and starting to act on.
Yeah. And I guess in most countries, this would actually come under legislation already, right? Under duty of care and for both employers and employees. And
absolutely. Wherever you've got legislation that talks about general duties to protect the health and safety of your workforce, that inherently includes psychological health and safety. So even if it's not explicitly in your legislation, if you've got those general duties, then yes, you're responsible for reducing psychological risks to your workforce, the same as you're responsible for reducing physical risks. Yeah.
So things like the codes of practice, they're not legislation, but they're basically guidelines on how you can adopt, I guess, or meet the legislative requirements.
Yeah, and from a legal perspective, I think if you find yourself being prosecuted, the codes of practice in particular are held up as the minimum standard to which you should be performing. And you'll need to demonstrate that what you're doing is as good or better than those codes of practice if you find yourself in that prosecution situation.
Yeah. Now, interestingly, from the New South Wales code of practice information they put out, they surveyed the workplaces in the state, and they found that only 9% of workplaces were dealing with psychological health and safety from a systemic perspective.
I'd imagine that would be explicitly addressing it rather than other things that also happen to look after psychological health and safety.
Correct. So taking more of a systematic thing that might align with the code of practice, for instance, doing risk management, that sort of thing. But that means that, more than 90% of companies are not doing this.
Yeah, and that's not surprising for me.
But again, I see this as an opportunity for the health and safety profession, for psychologists. There's a lot of companies that need to do this and do it a lot better, and they're going to need a lot of hand-holding and guidance and support.
Yeah, and certainly, in the safety profession, there's always talk about, what's the next step change in safety? Well, here it is, it's mental health.
Yeah.
That's your next step change.
Yeah, absolutely.